very good evening to you. I'm Jennifer Sanders. A potential life-saving test is now more accessible to everyone. The genetic cancer test used to cost thousands, but it's much more affordable now. It analyzes genes to determine your risk for hereditary cancers. As KXAN investigator Arzo Dost explains, the prices dropped even more during Breast Cancer Awareness Month.
I want all my girlfriends. I want all of them to know. I want all of them to go and be tested.
Michelle Wittenberg can't say it enough. She thinks everyone should get a genetic cancer test.
Because after watching what my best friend went through, I wanted to know if I had this genetic marker.
Michelle's best friend was Andrea Salone. She lost her battle to ovarian cancer in 2014. After her death, Michelle says she was tested to see if she had any hereditary cancer risks.
I'm very fortunate. I don't have that genetic marker.
Was that a relief?
But there's a lot of peace that I have knowing that.
Now, that peace of mind can come at a much lower cost. Michelle's doctor at Austin area OBGYN and fertility is offering the hereditary cancer test for $119 out of pocket, less than half its normal cost. The office says testing has quadrupled in the last few weeks.
And here it is. It's just a saliva collection. So all we have to do is have them put a little saliva in the tubes.
Dr. Chris Seeker says the Colors Hereditary Cancer Test analyzes 30 genes that can tell you the risk of some of the common types of cancers, including breast, ovarian, pancreatic, and prostate. It's recommended for both women and men.
If we get a positive gene, we know how to tailor our screening to identify those and find them early so that we can get cures rather than treatments.
Dr. Seeker says for those who have a positive family history, there's a 10 to 15% chance that they're a carrier.
Surprisingly, we find these positive genes for people who don't have family history about 2% of the time too.
We checked around with other OBGYNs on the price of this testing. What we found is that you actually have to call the company your doctor uses, and the price ranges anywhere from a few hundred to more than $1,000 out of pocket. Now, health insurance could cover the cost if you meet a certain criteria, including having a personal or family history of cancer.
You can ultimately save your own life and maybe somebody else's in the process as well.
Michelle says early detection is key. Her mission is to continue her best friend's legacy. KXAN followed Andrea's journey closely as she pushed for a law that would make it easier for terminally ill patients like her to get access to experimental drugs. The Andrea Salone Right to Try Act became law after her death. It's also when Michelle helped start the KK125 Ovarian Cancer Research Foundation, which focuses on awareness and raises money for ovarian cancer research.
Well, knowledge is power, and we've all got to do more to be more knowledgeable about things like genetic testing.
Arzo Dost, KXAN Investigates.
And Dr. Seeker says results for the test take about 3 weeks. Now, the discounted rate will be offered until October 31st. Arzo also checked with Texas Oncology, which has developed a hereditary cancer program. The director there says genetic testing for hereditary cancer can actually be a little complicated, and that's why it's so important that each person receives the right test for them based on individual needs rather than choosing a test only by price.